let's talk about osteoporosis and what it is. Now, osteoporosis is a loss of bone mass and density, which increases your risk of breaking a bone or fracturing a bone. The bone essentially becomes more fragile. It's often termed the silent thief because people commonly don't know they have osteoporosis until after they've broken or fractured a bone, like a hip fracture, a spinal fracture, a wrist or shoulder fracture. Now, osteoporotic fractures are more common than heart attack, stroke, and breast cancer combined. But only less than 20% of people who have sustained these fractures actually get diagnosed and get started on the right treatment. All right, so it's a big problem. Now, although there are multiple factors that can increase your risk of osteoporosis, there's no one cause that's been identified. Now, if you were to be medically diagnosed with osteoporosis, you would undergo a bone scan, and that will measure your bone density, and you'll get a T-score, all right, which tells you basically what your bone density is. Now, if that score falls below -2.5, that means that you will be diagnosed with osteoporosis, okay? Your bones are more fragile and thinning. Now, if you have a T-score of -1 to -2.5, you would be termed osteopenic. So that just means, osteopenia means that you have lower bone density, it's not normal, it's approaching osteoporosis, but it's not quite there yet. So you do have a risk of developing osteoporosis. Now, how common is this diagnosis? Well, in Canada, there's over 2 million people that have it. That's almost like the entire city of Toronto. And over 80% of all broken bones in people over 50 years old are caused by osteoporosis. So it's a big problem and it affects a lot of people, both women and men. Now, what's your risk of osteoporosis and of fractures? Well, if you are a postmenopausal woman or a male over 50 years old, you will have a higher risk of developing these. Now, if you take medications called glucocorticoids, or if you've had 2 or more falls in this last year, if you're a smoker or you drink more than 3 drinks of alcohol per day, those, amongst a few others, would increase your risk of having osteoporosis. Now, what puts you at a real high risk is if you've broken a bone after the age of 40. And this would be a low trauma fracture, meaning basically you have fallen from maybe standing height. It hasn't been a huge force, but you've broken a bone like hip, spine, shoulder, or pelvis. Now, there's also a special risk calculator tool that you can find online at osteoporosis.ca. It's called the FRAX, F-R-A-X, the Fracture Risk Assessment Tool. And this can calculate your fracture risk over the next 10 years. So if you put all the information in, it's like a little bit of a survey, and you have a 20% or higher risk of fracturing in the next 10 years, that elevates your risk of having osteoporosis. So it's important, if you're over 50 years old and you have some of these risk factors, you definitely should be talking to your doctor or medical professional about getting your bone mineral density tested. All right, what are the typical signs and symptoms of osteoporosis? Well, breaking a bone from a low trauma fall, which I mentioned earlier. It's also known as a fragility fracture, and this really is, falls are the leading cause of fractures when one has osteoporosis. And as I mentioned, that low trauma fracture really just means that it's a result, a broken bone resulting from a force or a fall from maybe standing height that wouldn't typically break a normal, healthy, dense bone. Another sign of osteoporosis is a loss of height. And often you'll see that rounding of the mid-back. Now, this is usually from a vertebral or spinal fracture, but you may not know you've experienced one until maybe you've had an x-ray. But another way that you possibly may know that you have experience of vertebral fracture is simply by measuring your height. If you know how tall you were when you were a young adult and you get remeasured now, if you have lost more than 6 centimeters of your height, then it's very likely that you have sustained a spinal fracture and possibly have osteoporosis. Typical fractures that occur when one does have osteoporosis include the hip fracture, the spinal fracture, the shoulder, wrist, and pelvis. All right, now is it hereditary? Can it be cured or reversed? Well, if you do have a parent that has had a hip fracture, that certainly will increase or elevate your risk as well. So it's important that you tell your children, your grandchildren, your great-grandchildren to make healthy bone choices now. That will include exercise and healthy eating. The health of your bones now in their early years can really significantly impact your bone health later on. You know, by the age of 30, our bones have peaked or maxed in their size, density, and strength, and then after that, we start to lose bone. So the stronger your bones are early in life, it really will make a difference. Now, it's really important to know your risk, to get assessed and seek medical intervention and therapy to treat it, because the appropriate treatment can help reverse bone loss and prevent future fractures. I want to remind you, if you do nothing, your bones will continue to deteriorate and your likelihood of a broken bone and the associated negative impacts will significantly increase. So do something, not nothing. All right, now that we know what osteoporosis is, in the next video, let's talk a little bit more about the specifics of what we can do about it.